Well, hello, and thank you so much for inviting me to talk about the power of hospital and community partnerships and advancing health equity. I'd like to take the next 25 minutes or so just to share about our experiences during COVID when our Hispanic community was hit disproportionately with positive cases, and we joined forces with many people and organizations on a specific plan to mitigate the spread of the virus. Our hospital was honored to be recognized by Healthgrades as one of 24 hospitals across the country with outstanding COVID response. And while the scope of that care is certainly far greater than the small piece I'm covering today, we thought that you might be interested in this case study on how the community rallied together to ultimately help save lives using multiple avenues of outreach, many of which were on the grassroots level using informal influencers, if you will. This experience has really given us a renewed perspective on what we can do when we work together and ask the community directly for their guidance and help. It's been very rewarding, and we have strengthened relationships that we are carrying forward to other health issues that we face. So we're just going to start right at the beginning. In the early days of the COVID-19 pandemic, NGHS tested and were treating a higher proportion of COVID-19 positive cases among the Hispanic, Latino, Spanish-speaking population as compared to the same demographic in the Gainesville-Hall County population at large. Approximately 50% of the positive Hall County cases reported by the health system were identified as Hispanic, Latino, Spanish-speaking compared to the lower demographic makeup of this population segment in Hall County of 29.4%. In April of 2020, Northeast Georgia Health System convened a group of leaders in Gainesville-Hall County to begin looking into outreach and education opportunities related to slowing the spread of COVID-19, given the data that showed a disproportionate number of positive cases were emerging in the Latino community compared to population rates. So the group quickly developed a Hispanic Latino community education action plan for COVID-19. The outreach committee that we put together had around 30 members and represented organizations that I've presented on the slide here. It was a really great group that included some of our board members as well as others, providers, our indigent clinic, the Poultry Federation, the Hispanic Alliance, our Latino Chamber, and more. So our objective was to mitigate the spread of COVID-19 using grassroots outreach, supported by simple PR messaging and reinforcement. Outreach was to be delivered in a culturally sensitive and respectful and compassionate manner. The overall approach was to have multiple touch points, use the same simplified materials at pulsing intervals to give us the best chance to change behavior and reinforce best behaviors. This would happen through churches, at the point of care, employers, schools, EMS, and police. In May of that year, the governor, the insurance commissioner, and Dr. Kathleen Toomey of the Georgia Department of Public Health visited Gainesville and asked Norma Hernandez with the Northeast Georgia Latino Chamber of Commerce to convene a group to discuss outreach to the Latino population. Norma invited many of the members of the NGHS small group to participate in that first meeting. Adding other leaders to this group, this task force shortly formed as Gainesville Against COVID-19 under Norma's leadership. The NGHS group and Gainesville Against COVID-19 worked together to continue reinforcing health messages, with the task force taking on the mantra of no mask, no service among the businesses in Gainesville, Hall County. The work of these groups has definitely did ultimately help to decrease the number of positive COVID-19 cases. And here are just some of our unique and not so unique things that we did. We created some simplified health messaging, flyers, posters, targeted specifically to this population using feedback directly from the Latino community. The CDC messages were great and full of good information, but the feedback we got was that it was too complex and needed to be simplified for better understanding. Our partners in the school system actually spoke with parents and asked them for feedback on health education materials, and so this was direct feedback from them. We revised also our patient education materials that we gave to positive patients for simplicity and better understanding. We also did door-to-door outreach in the community, also in grocery stores, at homes and in apartment complexes, and with the school system on lunch deliveries. We paired that also with face mask distribution. This is where we created a partnership with Emory-Rollins School of Public Health. We had students paired with outreach staff from the school system as they delivered lunches to homes, and they also delivered bilingual health messages while they were there. Some other things we did were videos by Latino, Hispanic, quote, influencers, and we released those on social media. We also did public service announcements on Latino radio stations. Our social media posts by businesses and individuals was pretty vast, and it was really pretty amazing how many people liked to get their information from trusted sources on social media. Oftentimes, we partnered with our local indigent clinic called Good News Clinics because they are a very trusted source within the Hispanic community. Many of our committee members are leaders in the community, so when they would share our joint messaging, it really reached people quickly and in an efficient way. Oftentimes, we just had to think about tailoring our messaging, shortening it, and making it quick and easy to understand. We even did some videos for taxi companies about how they could clean their vehicle between rides and how to ride safely with passengers, and again, targeted that to local taxi companies. We also did many Facebook Lives, and we used some of our well-known, well-loved physicians. Dr. Antonio Rios was one of those, and others, and we co-hosted those with organizations like the Hispanic Alliance. We also did media interviews through TV, radio, newspapers, and periodicals. I mentioned our partnership with the Emory-Rollins School of Public Health and their response team of students to work in Gainesville City and Hall County to educate families and provide testing. We even had some really creative TikToks from students in the school system so they could reach their peers and families with safety messaging. We also hosted testing events, and this was back when testing was a little harder to come by. We did that in partnership with Good News Clinics and the Rollins School of Public Health, and also always paired that with mask distribution. We even had some participation in clinical trials for saliva testing for COVID-19 in partnership with those that I just mentioned. We also provided some specific testing events to local poultry companies who wanted to have that brought into their businesses. We had some great, again, partnerships. We had a face mask making and distribution effort that was spearheaded by the Northeast Georgia Latino Chamber of Commerce. We also had support for underserved populations that needed masks and cleaning supplies, and that was spearheaded by our local United Way of Hall County. As I mentioned, we had several Zoom meetings to keep people up to date on the latest information about COVID. We did those specifically targeting churches. We did some for businesses through our chambers, and also for skilled nursing facilities. And you can see in this picture, that's Dr. Supriya Manapali. She's our Director of Infectious Disease and was a great spokesperson during that time. We also had a lot of ongoing communication and support for our regional indigent clinics that were caring for vulnerable populations at that time. So you can see how the reach of this was really across a broad range of organizations. And we certainly didn't do this by ourselves. It was through these partnerships. So I wanted to share this quote from our CEO. She really says it best here when she summarized our community partnership experience through COVID. She said, our COVID-19 response has taught us strong lessons in organizing quickly with partners in our community to reach underserved and vulnerable populations. So with testing, education, and eventually that vaccination that finally came, we learned new methods for partnering with others to reach these areas and to help ensure the health and safety of those most at risk. These lessons will live on past the pandemic and prove invaluable in future efforts to improve health equity in our community. And it certainly has. We also have held a couple of what we called community conversations. We partnered with our African American community through a local church and a local group called the Newtown Forest Club with deep roots in that community, and our local health department to provide COVID education specifically targeted to the African American community. We held planning meetings, talking with members of the community and people from these organizations to make sure we were covering the right topics in the right way. Many of these conversations led us to look more deeply into our COVID outcomes by race and ethnicity to really understand what was going on. And now, with the benefit of hindsight, we are doing an IRB approved research project to understand even better over time and looking at those surges that happened. How were different races and ethnicities and age groups affected by COVID? Why did some have better outcomes than others? Did those that have better outcomes have less chronic health problems to begin with? Were there delays getting care? And if so, why? These are some of the questions we're asking ourselves as we look back at this data. We're still working on this and with the strength of our research department. So just know that we do plan to share what we learn, and it's a pretty massive project. So around this time period, a couple of cases caught national attention. I'm sure you recall George Floyd, the murder of Ahmaud Arbery, and Breonna Taylor. So a local group of us began having some really open and honest conversations through what we later call the One Hall Advocates through our local United Way around social justice and equality. And that group is currently taking what were small group discussions out into the larger community to have more small groups with community conversations related to diversity and equity. That group is really growing right now and opening the door through conversations about related movies and literature. Our board chairperson, who is Philippa Lewis-Moss, has led this effort, and it is really through her personal passion and great facilitation capabilities that this has gotten off the ground. We also worked in partnership to create a COVID leadership coalition made up of leaders in the community from our city, our county, school systems, etc., that would meet monthly and would reconvene from time to time. We had some good diverse representation on this group, with many from our Hispanic Outreach Committee. And from this, a group called Hall In was formed. And this was a community-wide initiative to encourage the use of masks and other best practices from CDC. We had hundreds of businesses and nonprofits join and provided a website with resources just for businesses. We also started a COVID vaccine planning committee for the region that met weekly. While some of the work of this group was operational, we always had an eye on our data, looking to see that all populations were getting the vaccine and troubleshooting where we saw opportunities. We also hosted a group of about 20 in the poultry industry who at that time were looking to set up their own vaccination efforts in-house. And the president of the Poultry Federation and our agri commissioner joined as they toured our Northeast Georgia Physicians Group operation, as well as the Longstreet Clinic's operation. Several key staff debriefed with them and shared lessons learned and answered questions. The governor reached out to Norma once again and asked her to gather leaders in the community to talk about vaccination planning in Hispanic communities. And again, our relationships were already there, so lines of communication were open and happening. Northeast Georgia Health System and its COVID hospital community partnerships was featured at the American Hospital Association's joint virtual conference of the Association of Community Health Improvement and Institute for Diversity and Health Equity. And this was titled Accelerating Health Equity. So hospital and community partnership work at NGHS was one of 3 partnerships featured during a virtual networking session, and the content is very much what I'm covering with you today. Samuel Masonette, who chaired our quality committee and also served on the Hispanic Outreach Committee, and I represented the organization on this panel. Also, significant legwork is being done through our Charity Care Committee to look at preventive care offered to the uninsured, low-income populations we serve and opportunities for improvement. So there's lots of work happening on that front. We also had a concerted effort during flu season to work with the community to ensure that all populations had the opportunity to be vaccinated and educate on why get the flu vaccine. And while not necessarily related to COVID, but yet it is in a way, because building a diverse population of employees is key. Other diversity, equity, and inclusion work in our organization centers around graduate medical education, diversity in medicine series for both employees and community members, as well as implicit bias training for leaders and employees. So we continue our work to understand and respond to community health needs. We are in the midst right now of our 2022 Regional Community Health Needs Assessment, where we are partnering with other nonprofit hospitals in our region to understand more about the health needs of our community. We will identify priorities and create specific action plans for improvement. We're also working on a shared digital platform called Unite Us to meet the needs of people with mental and behavioral health and other health needs, so we can get them the help they need through referrals to community nonprofits. We know that issues like unemployment, food insecurity, poor housing, and social isolation play a detrimental role in overall health. So we're trying to get more upstream on this, working with our community partners. We want to minimize social determinants that can result in poor health and unnecessary suffering. And then the COVID research project that I mentioned earlier. You know, more and more we are looking at health through the lens of health equity and opportunities to partner to better understand the needs of our diverse community so we can help meet them. Do we have all the answers? No, we are still learning and likely always will be. This is an ongoing effort, a marathon, not a sprint, involving many areas of our organization and our community. We will keep learning, keep partnering, and keep in mind the lessons learned through this COVID experience. Two of the biggest takeaways are, one, we are better together than we are apart. And also, no one organization has all the answers. There really is a role for us all to play. And when working with different segments of the community, have a listening and a learning attitude. Always be culturally sensitive. Know that you may not know what you don't know, and act with respect and always with compassion. Thank you so much for having me. I have included my email on this last slide in case you have questions. Thank you again.